Hi guys, welcome back to my channel. Okay, so in today's video I'll basically be showing you guys a very easy way of drawing the bronchopulmonary segment of the lung. Okay, so the bronchopulmonary segment is a very important topic as far as thorax anatomy is concerned, okay, because of its clinical and surgical relevance. All right, so you know what bronchopulmonary segment is. Okay, the bronchopulmonary segment is the basic functional structural and surgical unit of the lung that is aerated by the tertiary or the segmental bronchi. So you know about your bronchial tree, that's the tracheobronchial tree. The trachea bifurcates at the sternal angle at the level of T4 to give you the principal bronchi. The principal bronchi further divides to give you the secondary lobar bronchi. The secondary lobar bronchi further divides to give you the tertiary or segmental bronchi. So it is this tertiary or segmental bronchi that aerates or ventilates this bronchopulmonary segment. And then there are 10 bronchopulmonary segments for each lung. Some authorities say that there are 9 in the left lung. All right, so this bronchopulmonary segment, each of them can actually be removed surgically without affecting the general functions of the others. So in today's video I'll be showing you guys how to draw it when it comes out in exam. All right, okay, let's dive in straight into the video. Okay guys, so let us dive in straight into the video. So this is we're going to be drawing the bronchopulmonary segment of the right lungs. I know that the bronchopulmonary segments are 10 in number in the right lungs. Okay, so first of all, this is the right lungs. So this is our costal surface, and then this is our medial surface. So you know that the lung has a costal surface and the medial surface. Then the medial surface has other parts, the mediastinal surface and then the posterior surface, right? So this is the costal surface. Let me label it. Okay, and then this is the medial surface. Okay, so you can see this now. The medial surface presents with the roots of the lungs. So okay, this is the hilum of the lungs, and then structures enter into the lungs from this hilum, forming the root of the lungs. Okay, so this is the impression, which is the hilum of the lungs. Okay, so I know that the right lung has so this is the dimension of the right lungs. Okay, I know that the right lungs has 3 lobes. So I'll be using red pen. So you have to first of all draw the lobe. Okay, so you know that the right lung has 3 lobes: the upper lobe, the middle lobe, and the lower lobe, and they are divided by 2 fissures. So this is our horizontal fissure, and this is our oblique fissure. Okay, so this is upper lobe, this is medial lobe, and then this is horizontal lobe. So same thing with this. So I make it like this too. Okay, so now it will help us in the attachment of the various bronchopulmonary segments. Now, the bronchopulmonary segments are 3 in the upper lobe. For the right lungs, there are 3 bronchopulmonary segments in the upper lobe, and then there are 2 in the middle lobe, and then there are 5 in the lower lobe. So how are we going to fix this? Okay, so I'll be giving you a mnemonic now. Stop. So guys, I have a mnemonic for you now. So this mnemonic says a palm. These are separated, PALM. A palm seed makes another little palm. That really makes sense. A palm seed makes another little palm. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. And I told you guys that 3 are found in the upper lobe. So the first 3, 1, 2, 3, are found in the upper lobe. The next 2 are found in the middle lobe. Okay, so I can use this like this. Middle lobe, which is L and M. Then the remaining 5 are found in the lower lobe. Okay, so our A stands for apical, our P stands for posterior, and is represented with 1, 2, then this is anterior and is represented with 3. So this is lateral, represented with 4. This is medial and is represented with 5. So this is superior 6. This is medial basal, represented with 7. This is anterior basal, represented with 8. This is lateral basal, represented with 9. And then this is posterior basal, represented with 10. So this is our mnemonic for the bronchopulmonary segment. So we have, for the right lung, so we have a palm seed makes another little palm. Okay, you can see how I separated this palm, all right? And I told you guys the first 3 are found in the upper lobe, which is apical, posterior, and anterior. Okay, the next 2 are found in the middle lobe, which is lateral and medial. Then the remaining 5, superior, medial basal, anterior basal, lateral basal, and posterior basal, are found in the lower lobe. How can we attach this to this? Okay, so you can see this is the upper lobe, so we should be having 3 bronchopulmonary segments here, right? Then this apical should be telling you it should be at the apex of the lung. So I should have something like this. Watch how I'm drawing this, it will make more sense. So I will represent it with the 1. Sorry, I used the Roman figure here, but I was trying to write 1 here. Okay, so this is apical, so represented with this. Okay, then 2 is posterior. You can see here is anterior and here is posterior. Remember that this is the posterior border of the right lung, and then this is the anterior border. Okay, so here should be 2 and here is 3. So I'm done with the upper lobe, right? Then in the middle lobe we have lateral and medial, so I should be having like two bronchopulmonary segments here. So we have lateral and we have medial. So it should tell you that this is medial because it is more. Remember that this space here is the medial septum called the mediastinum. So that means here should be medial because it is closer to the medial plane. Okay, so this should be our lateral, which is 4, and our medial, which is 5. Remember that these letters, these numbers are conventional, so you won't see that lateral is 5 and medial is 4 or otherwise. Please, lateral is always 4 and medial is always 5. Then in our lower lobe, that means we should be having 5 bronchopulmonary segments. So I'll be dividing this lower lobe into 5 regions. But mind you, medial basal will not be seen on the costal surface, but rather it will be seen on the medial surface. So I'll be omitting this. So when you're reading from your textbook and you see where they omitted medial basal, just know that the costal surface does not present with medial basal, because the medial basal is found at the medial surface of the lung. Okay, so how am I going to divide this? Remember, this is made superiorly, so I will divide it with this dotted line. So this is our superior, so I'll label it 6. Then I can now further divide it into, remember I'm excluding the medial basal, so we're having anterior, lateral, and posterior. Okay, I hope you guys are seeing what I'm doing. So this is the anterior, because remember that here is the anterior border, so here should be my what? 8. So I have 8 represented by the anterior basal. Then I have 9. This is lateral to this, and then this is the posterior most part, which is now 10. Remember I told you why I excluded 7 from the costal surface. So guys, you can see how I use this now to fill up the bronchopulmonary segment of the right lung. Does that make sense to you? Good. So the same thing happens here. Okay, now you can fill it up on your own. So I have to make a medial partition here, and then I cannot include my 7. So this is my medial basal. Okay, I hope you guys are seeing what I'm doing. So this is my superior part of the lower lobe, then 7 is my medial basal. This is the root of the lungs, and then the right lung, you should know the order. We'll be having our epithelial bronchi, you'll be having your pulmonary artery, okay, then you'll be having your hyperthermal bronchi, and then you'll be having your pulmonary vein. So I'll be representing the pulmonary vein with a red pen, showing that it's carrying oxygenated blood back to the heart. Okay, so these are root of the lung, so you can label it. So far so good. I've shown you guys how to draw the bronchopulmonary segment of the right lungs very easily. Remember this mnemonics: a palm seed makes another little palm. Okay, and you can fix in the numbers. You don't just fix them anyhow like I used to see most students do. They'll just divide it into 10 places and just be fixing any place they see. Please, it is not done that way. So let us see for the left lung. All right, so let us dive in straight into the bronchopulmonary segment of the left lung. So this is the outline of the left lung which I've drawn. I know that the left lung has two lobes, which are the upper lobe and the lower lobe, upper and the lower lobe. Okay, so here is the costal surface of the left lung, and then here is the medial surface. Okay, you can see this indentation or this depression is the cardiac notch and is characteristic of the left lung. Okay, so you have to present it, don't just draw anyhow. So your examiner will know that you understand the anatomy of the lungs that bears this bronchopulmonary segment. Okay, so this is our upper lobe. I won't be giving any mnemonic for this. Okay, once you understand the right lungs, that's why I did that first, you will definitely understand the left lung, just that there are just slight differences which I'm going to show you. Now, some authorities believe that the left lung has 10 bronchopulmonary segments, while some believe that they have just 9. That means the one that is not that is excluded is the medial basal. Okay, you remember the medial basal that I told you that is at the medial surface of the right lung. So some authorities excluded it, but then some authorities say that it is included, whichever way. Okay, so some authorities believe the right lung has 10 bronchopulmonary segments, while the left has 9. So either authority you are quoting, all of them, just understand the concept. Now, because there are 2 lobes, there will be 5 lobes here and 5 lobes here. That means if you're using the 10 convention, if you're using the 9, there will be 5 in the upper lobe and 4 in the lower lobe. Okay, so just that the inclusion is just what we call the superior and the inferior lingula. Okay, so just the same thing with the right lobe. So we have a apical, remember it's represented with 1. Then these are posterior. Remember, this is the posterior border and this is the anterior border. Okay, so this is 2 and this is 3. Okay, then in this place of the upper lobe, we'll be having 4 being our superior lingula, and then this one is inferior lingula. So you have to make this 4 to be higher than this 5. Okay, so this is superior lingula. So this is just basically the thing that is unique, this 4 and 5. Okay, so somehow this is the superior lingula, inferior lingula. So I'm going to put it here for superior lingula. Okay, and then 5 is inferior lingula. Okay, then every other thing in the lower lobe of the right lung is still in place. So we'll be having our 5, 6. This is superior, right? Superior in the lower lobe. Then we have our anterior basal. Remember, 7 is excluded, that's the medial basal. So 8 is anterior basal, 9 is lateral basal, and finally 10 is posterior basal. So the same thing is applicable here. 1. Okay, so this is 2, and then this is 3. Okay, so this is 4 and this is 5, this is 6. So in some authorities that included the medial basal, so we have to represent the medial basal here. Okay, but the letter 0 is 9. Okay, so I'll divide this into 3 parts. Okay, so this is 6, so I'm excluding 7. Then for the 8, remember that the 8 is the what? Anterior basal, 9 is lateral basal, and 10 is posterior basal. So remember that here is your what? Anterior border, so the anterior basal should be more at the anterior bosom. Okay, so that is the various pulmonary segment for the left lung. So this is the uniqueness, the superior and the inferior lingula that we are added to it. I believe if they ask you to draw your bronchopulmonary segment, you can be able to draw it for the right lung and for the left lung. Okay, so don't forget our mnemonic. A palm seed makes another little palm, and it really makes sense. Then for your left lung, remember that the uniqueness is just the addition of superior lingula and inferior lingula. And I told you, okay, this is the hilum of the lung that bears the root of the lung. I know it is different when you're moving from the superior to the posterior, so you can fill it up. There is only one principal bronchi in the left lung, and then two in the right lung. That's the epitheria and the hypatheria. So in the left lung, we'll not be having epitheria bronchi, so we're having pulmonary artery. Then we'll be having our bronchi, and then we'll be having our pulmonary vein, right? So that is that for it. Thank you, and do have a nice day.